Hi friends, today discuss about the metabolism of tryptophan. Tryptophan, one of the most important aromatic amino acid. Out of three aromatic amino acid, phenylalanine, tyrosine and tryptophan. Tryptophan is so important for the many biological action. They produce some biological compounds and they are intermediates. That intermediates produce some biological action. So tryptophan is very essential amino acid for our body. Now it is metabolized, how it is synthesized and how it will be catabolized, that we can see in the later on. At the same time, I also say you all the students, all the listeners must be stay at your home and stay safe for the prevention of COVID-19 and safe of your body also. First of all, this introduction, the tryptophan, which is discovered in the 1890, Ernest Steinman discovered the tryptophan and Hopkins determined the structure in the year 1901 and established its essentiality of the growth in 1906. Tryptophan is an aromatic essential amino acid with a indole ring, totally different ring. It is indole ring, and tryptophan both glucogenic and both glucogenic. They produce glucose and also ketone body also. The substances produced from the tryptophan, so many compound which is produced from the tryptophan. That's why the tryptophan is very essential amino acid, otherwise these compound will not produce. First of all, alanine, that is glucogenic, acetoacetyl-CoA ketogenic for mild group 1 carbon unit, niacin or NAD, which is another most important coenzyme which is almost reaction in the every reaction. Serotonin, which is another neurotransmitter, and melatonin hormone, which is also another most important function, and hydroxyindole acetic acid, which is the excretory product. After metabolite, it will be excreted through urine, and indicant, which is the another excretory product. Now tryptophan will produce so many compounds. First of all, tryptophan in presence of N-formyl ketonuria, it produces kynurenine, and it after it in the 3-hydroxykynurenine in presence of some enzymes, they produce alanine or alanine amino acid, which is a glucogenic, and they produce the carbohydrate compound also. If the presence of PLP, phosphoribosyl pyrophosphate, and 3-hydroxyanthranilic acid to amino carboxylic acid, then it will be decarboxylation. It produces amino gluconate and aldehyde and ketoadipic acid to acetoacetyl-CoA, which is the another ketogenic substance. So in this reaction, we can see glucogenic and ketogenic substances are synthesized from tryptophan. Synthesis of niacin, which is the most another important cofactor which is essential for the so many enzymatic reaction. Nicotine or nicotinic acid pathway of tryptophan. About 97% molecule of tryptophan are metabolized in the major pathway. About 3% molecule are diverted in the level of 3-hydroxyanthranilic acid and to NAD. And these enzymes QRTA, quinolate, phosphorylate transferase, it is the rate limiting steps. About 60 milligram of tryptophan will be equivalent to 1 gram of nicotinic acid, and the development of the pellagra due to deficiency of nicotinic acid in this mice eating produce, it is due to the tryptophan deficiency in the mice. Another is the hydroxyxanthanate produced in the dependent on the pyroxyphosphate. Hence, it is vitamin B6 deficiency or nicotinic deficiency is most manifested. You can see it how the tryptophan can produce it nicotinic acid. The 3-hydroxyanthranilic acid just before the reaction, quinolinic acid, niacin or nicotinic acid, then nicotinamide monoadenine, then NAD, and then NAD or nicotinamide adenine dinucleotide. These are the components which are acts as a coenzymes in this so many enzymatic reaction. Then is the serotonin. another most important neurotransmitter, or it is commonly known as the 5-HT or 5-hydroxytryptamine. Serotonin is produced in the brain, muscle, platelet, and gastrointestinal tract of the mucosa. Tryptophan is the first hydroxylated by the tryptophan hydroxylase, and this reaction is much more similar to the phenylalanine hydroxylase. The coenzyme is the tetrahydrobiopterin, and the tetrahydrobiopterin is generated using the NADPH. In the next steps, the 5-hydroxytryptamine is the decarboxylated to 5-hydroxytryptamine or serotonin. The enzymes decarboxylase required for pyridoxal phosphate. The effect of serotonin is depend on the amount of serotonin available in the synaptic site, and part of the serotonin release in the again taken by the reuptake, and selective serotonin reuptake inhibitor or SSRI are the widely used in the treatment of the so many psychiatric disorder. Nowadays this is very aggravating disorder, mental depression, psychiatric disorder. In this case, this SSRI or selective serotonin reuptake inhibitor like acetylopram or this like compound which are used as a serotonin inhibitors. What is the function of that? This is the most important function of the serotonin. Is the most important neurotransmitter in the brain, and the brain cell serotonin is the bound form, and reserpine cause the rapid. This lead to clumping effect and depression. And on the other hand, 5-hydroxytryptamine is an antidepressant. When the ordinary protein are taken, only the amino acid are available in the blood, and they causes traffic jams in the amino acid and transport system in the brain cell. Tryptophan are the bulkish amino acid is there is no up, very slow. So tryptophan is easily, however, the carbohydrate rich diet taken, insulin secreted, the increase secretion is increased, and which is will be lower the amino acid concentration in the blood. So tryptophan easily enter into the brain cell, and when the tryptophan is available in the brain cell exceed quantity, then serotonin may be generated to induce sleep. And carbohydrate will, that is in that mechanism, the carbohydrate will induce sleep. Generally we are seen when you take the high carbohydrate content in the lunch or the dinner, and after that you are sleep, because this carbohydrate content is less concentration and increase the lower the amino acid level concentration. At that condition, tryptophan goes to the brain and they produce serotonin, and serotonin produce sleep. That's why when you take much more amount of carbohydrate, that produces sleep, and while the protein rich food will do or the alertness. That's why if you alert in the night, always you take the protein diet, not the carbohydrate containing diet. If carbohydrate containing diet, there is a sleep will be occurred. If protein rich content diet, there is a weakness. The sleep serotonin level is found in the low in patient of depressive psychosis. Serotonin is involved in the mood, sleep, appetite. Basically the three reaction: mood, what is the mood, your mind, young sleep disorder, sleeping condition, and appetite. That will be appetite, that means hungriness, and the temperature regulation. Four more major function by controlled by the serotonin, and it increases the gastrointestinal motility also. That's why if the serotonin level is high, there is a chance of diarrhea, and sensitivity to pain is reduced by serotonin. How to serotonin will be produced? Generally tryptophan, then it will be produced tryptophan hydroxylase enzymes. They produce 5-hydroxytryptophan. Then PLP, in presence of PLP dependent amino acid decarboxylase, they produce 5-hydroxytryptamine, and then it is formation of acetyl serotonin in the by the acetylase, or 5-hydroxyindole acetate or 5-HI, which is excreted. Then acetyl serotonin in presence of methyl transferase or SAM, S adenosyl SAM, SAM means S adenosyl methanones to S adenosyl homocysteine, which is the methyl donor. They produce melatonin. So in the same pathway where the tryptophan can produce serotonin as well as the melatonin, and the serotonin function already discussed, and the melatonin function will be discussed in the later. What the catabolism of monoamine oxidase MAO is the converted serotonin to 5-hydroxytryptaminic acid, which is the very essential component of the drugs which is discussed in your later class. The MAO is the oxidatively deaminated compound having an amino attached to the carbon atoms, and this similar to degradation of epinephrine in case of, and MAO inhibitors or iproniazide, which is the drug, will cause the mood elevator. So that's why in case of the depressive patient, the iproniazide can mood elevated, and small portion of serotonin is conjugated to the sulfate or with the glucuronic acid and excreted through urine. That is the excreted metabolic pathway of serotonin. Carcinoid tumors. Serotonin is produced by the argentogaphin cell of the gastrointestinal tract, and it is necessary to GI tract motility. It is the normal phenomena, but the cell may be grow into the local malignant argentogaphinomas, otherwise known as the carcinoid tumors. These carcinoid tumors develop in the small intestine, in the appendix, and the serum level of the serotonin is increased in the carcinoid tumors is more than 40 mg per dl. And sometimes oat cell carcinoma of lungs may also be shows increase the serotonin secretion. Melanin is the pigment of the hair and skin. It is synthesized from the tyrosine. And melatonin, be careful, remember it. Melatonin is the neurotransmitter which is synthesized from the tryptophan. Melanin, don't misunderstand with the melanin and melatonin. Melanin is synthesized from the tyrosine, which is used as a skin pigment like hair and skin, but melatonin is the neurotransmitter which is synthesized from the tryptophan. Though all are aromatic amino acid, but their source is totally different. Be careful, be serious, it will be remember it. Melatonin, the serotonin is acylated step, the same pathway. Heard it is 5-hydroxytryptamine or melatonin. The acylated the step 4 in the previous reaction. Further, it is methylated in the with the S-adenosyl methionine, and this pineal gland produces this melatonin. It is the intimately connected with the diurnal variation. What is diurnal variation? The diurnal is the sleep-wake cycle. In the sleeping condition, there is a wakes up and in the biological rhythms. And sometimes melatonin blocks the MSH, melanocyte stimulating hormone, and excitates adrenocorticotropic secretion. The activity of melatonin as a neurotransmitter as discovered by the Julius Axeler, who was the award Nobel Prize in the 1970. The major excretory product of tryptophan. So many major excretory product. First is the tryptophan converted to indole pyruvate to indole acetic acid. Then it is stachyl and indole indoxyl sulfate to indican. These are the compound. All are metabolic product of tryptophan, and that will be excreted through the urine. And some part of the absorbed by the detoxification excretion in the indoxyl and indican. And indican is the potassium salt of indoxyl sulfate and the female foul smell of a feces and the nature of the color of the urine due to this compound. And normal excretion of the indican in the urine is 40 to 20 mg per day, and which is increased in the heart snap disease, which is very important. The heart snap disease due to tryptophan. What is heart snap disease? Which is the name originated after the first family in whom disease was discovered. It is a inherited autosomal recessive diseases. And absorption of the aromatic amino acid from the intestinal as well as the reabsorption from the renal tubules are defective. So amino acid are excreted in the urine. The Pellagra-like syndrome due to NAD due to deficiency of niacin derivative of tryptophan. The common manifestation are dermatitis and ataxia. Dermatitis means skin eruption, and ataxia means the chance of shock, that is called the ataxia. And the diagnosis is based on the amino aciduria, that means amino acid passes through the urine, and increased excretion of indole compound detected by the Weber-Meyer test. And patient improve the when he put the high protein diet with the supplement of niacin and minimum exposure to sunlight. Summary of tryptophan metabolism. The tryptophan can be produced serotonin, melatonin, 5 indican. These are the two compound indican and 5-HIA indole hydroxy indole acetic acid which is excreted, and serotonin is the most important compound for regulation. Melatonin also same, but another N-formyl ketonuria, the kynurenine, which is converted to the glucogenic alanine, another ketogenic acetoacetyl CoA, another NAD. There is a three component: glucogenic, ketogenic, and NAD. And the formyl tetrahydro 1C carbon unit, which also produce after tryptophan metabolism. Metabolic most important function: metabolic fate of amino acid. Here not only related to the tryptophan but also the other amino acid, how it will be act. First, the glucogenic amino acid: alanine, glycine, serine, threonine, cysteine, tryptophan. All are glucogenic. Sometimes it is also ketogenic also. They produce pyruvate, and pyruvate to oxalate or aspartate to oxaloacetic acid. This goes into the TCA cycle, which is already discussed, and then oxaloacetic to glucose. That's why it is called glucogenic amino acid. Another ketogenic amino acid like leucine, lysine, isoleucine, phenylalanine, tyrosine, and tryptophan, which is produce the acetyl CoA directly from these amino acids. These acetyl CoA then produce the ketone body, and these oxaloacetate and acetyl CoA ultimately goes into the citric acid cycle. Citrate, alpha ketoglutarate also glutamate. They produce the arginine, histidine, and then succinyl CoA, methionine, isoleucine. So all the amino acid which are involved in the or cover up the TCA cycle, not only by the lipid or carbohydrate but also the all amino acid which is control or running up this citric acid cycle. So we can see so many amino acid which are involved in the metabolic role. I think all of you understand. If you not understand any portion, please comment me in our comment box or any other way, or mail me or in the WhatsApp group. So thank you for listening, for your patience. If you understand, then it is like it and subscribe it our channel. Thank you so much all the listeners. Thank you all. Thank you. Please, any question, please ask me again in the next class.